battling coronavirus. The FDA has officially approved the Pfizer vaccine for adults 18 and over, and Moderna has submitted its filing. So we could soon have 2 FDA-approved COVID-19 vaccines. And I want to welcome back family medicine practitioner, Dr. Nicole Swiner. Doc Swiner, thanks for joining us. Now, with this FDA approval, what do you think that means in terms of providing some relief to those who have been vaccine hesitant?
I'm excited, and now, of course, the door is open for even more conversation for those who were kind of waiting for this to happen. You know, we knew we had the safe option when the FDA did it as an emergency, but it gave a lot of people some pause. You know, was it too quickly? You know, did they skip steps? But now that the FDA has given its official stamp of approval, I hope that more people will be open to going ahead and getting vaccinated.
Let's talk a little bit about boosters. So it's now out that, look, 8 months from the time that you got that second vaccination shot, you need to be going ahead and getting a booster. How safe is this? And does it matter which booster you get? If you started with Pfizer, can you go get a Moderna? If you started with J&J, can you go, how does that work?
Good question. So we, at our clinic at Durham Family Medicine, we're excitedly getting the schedule together. We have Moderna. We have Moderna in particular. And people have already been calling and trying to figure out, when should they get themselves on the schedule 8 months from their second dose of either Moderna or Pfizer. So you also asked a good question about, can you mix and match?
Yeah. Can I hop over to the FDA-approved one?
We don't know. We don't have an official recommendation yet from the Johnson & Johnson side of things, so we're still waiting on that. It seems as if the recommendation is not to mix the mRNAs. So if you got Pfizer, it seems as if it's not a good idea to switch over to Moderna. I think the jury is still out on that, but for now we're trying to stick with what you got originally. And the boosters are as safe as the initial doses are. So there's no change in rate of efficacy for the first variant of coronavirus, and no change in the amounts of side effects. And it's just one dose. You don't have to get 2 doses this time. It's just one as a booster.
It seems as though people are really concerned about the fact that there needs to be a booster shot so soon after the initial inoculation. Does this have anything to do with the Delta variant's potency or the number of people who've been vaccinated?
Correct. So just like the flu shot, viruses mutate, they multiply, they change, they become new. So with the flu shot, every year, there's potentially a new variant that we're fighting against. So we change the type of flu virus that we're attacking. The same is probably going to be true forever with the coronavirus. It's going to change. It's going to learn what we're doing. It's going to adapt. It's going to, virus is very smart. So I was not surprised. I actually thought it was going to be sooner recommended that we needed the booster. I thought it was going to be at 6 months, really, to be honest with you, because we were thinking in between 6 to 12. So 8 months is kind of right in the middle. I'm not surprised, and I won't be surprised if we will have to continue doing annual updates just to make sure that we're staying on top of, the technology that these viruses will adapt to.
Yes, well, the Delta variant has really changed some things. I mean, we have seen the popular memes, my fall plans, the
That's
Delta
right.
variant. And at this point, it's causing quite the divide in families and in friendships. Some are even afraid to tell their loved ones that they got a shot or didn't get a shot. So, people don't want to offend anybody, but safety is priority number one. So can you talk about ways to be have COVID etiquette? How do you talk to family members or even friends who are socializing without masks, traveling freely, not vaxxed, but they want to come to the cookout?
Yeah, that's great. I mean, you tell me. I don't know. I'm going to have this conversation too. I literally this week just started thinking about the holidays, where we're going to go, who are we going to be with. You need to be very selective, and you will have to have those uncomfortable conversations with households that may have thought differently or do things differently protocol-wise, or maybe have not gotten vaccinated and your household has been. So in our case, the 2 adults in the house are vaccinated, but our 2 kids are under 12, so as of right now are not vaccinated. Very concerned for their health and their safety. And we do have some family members that have not decided to get the vaccination yet. So that's going to be a very awkward but necessary conversation about Thanksgiving, about Christmas. are you guys going to get vaccinated? Do you plan to be? If not, as a medical provider in the family, can I answer a question for you? If you're not going to be vaccinated, will you get tested? Will you quarantine prior to? You really have to have those conversations. I would not, take on gatherings willy-nilly. I would really be choosy and selective about where you go and who you're around.
And who's in greatest jeopardy, if anyone, when you've got an unvaccinated crew there and a vaccinated crew there? I think that the people who have the vaccines are probably under the impression that they're in danger or that things aren't safe if there are folks around who haven't been vaxxed. But who's really in danger here?
I mean, to be honest with you, everyone, because as you know, these variants have learned a little bit about the vaccines that we have out. And so the vaccinations, to be honest, are slightly less effective for these new variants. And so even if I, as a vaccinated person, come into contact with an unvaccinated person or with someone who has an infection from the Delta variant, I am still at risk for getting infected and then bringing it home to my unvaccinated children.
So everyone has
is
got
at
to
risk.
be cautious and exercise those safety protocols. Dr. Nicole Swiner,